Welcome to California in Focus. I'm Dave Mason, the Southwest editor with the Center Square. I'm here today with Kenneth Trump, the California reporter for the Center Square. Kenneth, you had an interesting story this week about a California father who became shocked when his bill for an ambulance doubled for his daughter. I understand the dad had a troubling phone call. What happened?
Yeah, unfortunately, this California father's bill for his ambulance ride doubled after he provided his insurance coverage instead of actually going down, which he would have expected. And this is because of a new state law that he says punishes him for having coverage. So I'd like to actually share some of what was said in this conversation between social media star and father Robbie Witt and his call with the billing department for the ambulance. So Robbie was initially billed $603.34 because the ambulance company assumed that he was an uninsured patient. So wanting to cut down that $603 bill, he submitted his insurance details. But unfortunately, his bill actually doubled when he did so to $1,263.29. So naturally, he called the company to see what was going on. So the billing department representative told him the first invoice he received reflects the discount that one gets for being uninsured. And that after submitting the bill to his insurance, that his insurance only covered about $1,100 of the $2,400 bill. So when Witt asked if he can get a discount, if he canceled his insurance, he was told that because he had active coverage on the date of service, that he couldn't get the discount back by canceling his coverage now. The father, Robbie, said, "So I'll get cheaper health care if I'm uninsured. I pay for insurance and I end up paying more out of pocket because I pay for a premium. That's wild." The billing department's representative then said that a California law is actually responsible for this because AB 716 requires that uninsured patients receive this discounted rate.
So I think the father had an interesting suggestion then to the customer service representative. What was that suggestion?
What he did ask was if he wants to pay less for medical care, if he should just cancel his insurance. To which the representative said he doesn't really know because that's not really his domain. Let's actually look more, though, into AB 716. It requires that uninsured patients be billed the same low ambulance rate as whichever is the greater of what's charged to the taxpayer-funded Medi-Cal or Medicare programs. These are publicly funded healthcare programs. Medi-Cal is for lower income individuals. Medicare is for older individuals. So the fact that his initial bill was really low it reflects this discount rate that's required for uninsured patients. They get the same cost as the taxpayer-funded program. The bill does also require that out-of-pocket costs for insured patients using ambulances is the same for the patient, whether the ambulance provider is in-network or out-of-network. So the fact that Robbie's bill doubled after submitting his insurance does show that he has a very high cost sharing plan. So he probably is having lower premiums in exchange for higher cost sharing. So it's more of a catastrophic coverage type plan. But this doesn't really seem fair to Robbie, right? Because instead of using either taxpayer funded insurance, having no insurance, he's trying to save money. So he's just choosing a less expensive insurance option. But in addition to paying taxes and paying for these premiums, he's now having to pay a much, much higher rate because of what his coverage offers. And it's especially high compared to what happens if you don't have any insurance or are on a taxpayer funded program. So this really doesn't seem fair to the average Californian.
I know he posted his telephone call with that video on social media. What's been some of the reaction to what he went through?
People are really shocked at what happened, but they're not surprised that it happened in California. This is a state where healthcare benefits and priorities go to two, very different groups of people. It really does seem to provide the most benefits to either the very wealthy or the very poor. The state recently eliminated means testing for assets for getting taxpayer funded long-term care. This really impacts disabled individuals and older individuals for this very expensive long-term care. But by eliminating the asset testing, this means that some people who have very high net worths but no income because they don't work anymore are able to get taxpayer-funded long-term care, which, as I said, is usually quite expensive because it can be very intensive and it could even be around the clock. The other beneficiaries of California's plan are people who are often uninsured or are at the income threshold to qualify for the taxpayer-financed Medi-Cal program. We've seen this happen with the recent system requiring a $3.4 billion loan after spending $9.5 billion this year on healthcare for undocumented immigrants.
Have you heard about any pushback in the legislature? Will there be any attempts, you think, to modify the Assembly bill on insurance?
I haven't seen anything regarding this specific law. What I can say is that there could be some federal legislation that does limit how the state can use its federal funding, or whether or not it can even get the right kind of federal funding depending on what it spends its money on. But those bills have not moved forward yet.
Okay. Well, thanks for your time, Kenneth. I appreciate that. Thank you for being on California in Focus. And that wraps up our report. You can find out more news from thecentersquare.com, where we cover the entire country, including California. Thank you for your time.